tell our public what you mean by induce.
So most people know that at some point a baby's got to come out. And so many women go into labor on their own, or what we call spontaneous labor, meaning
Like their water breaks and then
they start having regular contractions where they're like, this is annoying, and then it increases in intensity and frequency. You're like, okay, something's
Not like it's going
right.
to be.
That's right. And then sometimes their water breaks. Sometimes they come to the hospital for other reasons. We check your blood pressure at every prenatal visit. Occasionally, patients can be diagnosed with high blood pressure just because they're pregnant. There's something called preeclampsia that is a disease only of pregnant women, where they may have headaches, vision changes, typically have elevated blood pressure. Blood pressure may be so elevated that we say, you know what? The cure for preeclampsia is delivery, and so we need to induce you. And what that means is that we give you medicine to make your body go into labor. A lot of the early labor that you would have at home that you might not even notice happens in the hospital. And so there are a variety of different methods that we can induce somebody for, and there are a variety of different reasons that we might recommend that. We also know that the ideal time for a baby to be born is somewhere between 39 and 40 weeks. So kind of from the week before your due date. Many women nowadays have other children, they have other responsibilities. Childcare can sometimes be an issue, and so a few years ago there was a national study that was done looking at, is it okay to induce somebody after 39 weeks, or should we just let them stay pregnant up to a week or two after their due date? How do babies do? How do moms do? And we now know that there is not an increased risk of C-section from being induced somewhere between 39 and 40 weeks. A lot of the labor that you would have at home is going to happen in the hospital, but for some families and some women, frankly, they just get tired of being pregnant. It can be a lot on the body. It's really hot in North Carolina in August, July, June, and so it's one where sometimes people just choose to be induced after careful counseling by their provider as to whether that makes sense or not.